Welcome back to part 2 of the Lead Poisoning Prevention and Immunizations Update, which is a presentation. It's part of a partnership between the Bloomfield Public Library and the West Hartford-Bloomfield Health District. I'm Susan Walsh, public health nurse at the West Hartford-Bloomfield Health District. Yesterday, we were speaking about lead abatement and work practices, safe work practices. And now we're going to talk about strategies to limit lead exposure in your home. All right, so good strategies are, as we talked about before, having washable mats on the inside and outside of exterior doors that you then frequently wash, so that the lead contaminants that would otherwise be coming into your house get washed and taken away from your home. Remember to take your shoes off before entering your house and keep your pets from tracking lead into the home. Prevent your pets from having access to bare soil. Clean their feet, clean their fur. Avoid dry sweeping, which spreads lead. If you're using a vacuum cleaner, use an industrial grade HEPA vacuum cleaner. That limits the particulate size that is able to get blown back into your room when you're vacuuming. Use wet cleaning for all non-carpeted surfaces, including floors, windowsills, window wells, counters, radiators, and toys. We use a 3-bucket cleaning strategy for when we know that there has been lead exposure. That's certainly something that you can do if you recognize that there are lead hazards in your home. That would be having 3 buckets of really hot water, put a high amount of detergent in one, have gloves on and a lot of clean rags. Start in a corner of your room, from sort of cleanest areas like walls and countertops to the dirtiest areas like floors. Start in a 4-foot space, use thick detergent water from that first bucket, clean about a 4-foot space, rinse with water from bucket number 2, rinse again with water from bucket number 3. Change your rags as needed, and then clean that space in about a 4-foot by 4-foot increments until that full room is cleaned. That's floors, walls, counters, everything. That really does bring down lead limits very effectively. And if you're able to do that and then prevent further lead contamination by taking your shoes off and having mats that you wash, then you wouldn't need to do that level of cleaning all that frequently. But all the maintenance cleaning would still need to be done as wet cleaning as opposed to using a broom. Wash your hands frequently. Hopefully it's been clear through all of this that a lot of lead exposure is people getting lead on their hands and then inadvertently putting it in their mouths, or having airborne lead that you breathe in. If you do have areas of your home that you can't repair or have repaired immediately, block those areas from your children being able to access them. So if you know that there's an area of a room that has some peeling paint, shift your furniture around to have that area be blocked. You can use tape and contact paper to cover up small areas also. And of course, if your child does chew on windowsills, chew on door frames, really work to block those areas and also talk with your medical provider. So lead can harm young children's growth and development. I just love this picture of this cute little kid. So be sure to talk with your providers and don't delay in getting blood lead testing. We're going to shift now to talk about immunizations. We'll only spend a little bit of time on this. The CDC annually updates their recommended immunization schedules. You can contact your primary care provider to make sure that you're up to date with vaccines, or you can contact us at the West Hartford-Bloomfield Health District. We'll be able to help identify vaccines that you need. You can access your own immunization record by logging into Connecticut's immunization program. It's called CT-WIZ. You can log on, create your own access code, and see all your immunization records. So when you all contact us and say, I wonder what vaccines my child needs or that I need, we use these forms from the CDC, which are updated annually, to identify what you need. This is all the pages together. You can certainly access it from the computer yourself, but I wanted you to have a sense of what we use to help identify what vaccines you need. This one's for children and adolescents. This one's for adults. We do offer vaccines here at the Health District. This is a flyer that shows which pediatric vaccines we offer and what adult vaccines we offer. We do it by appointment only, so call our health district and schedule any appointments that you might need. We also have community flu clinics. These are our current flyers for October and November. You're welcome to show up for our flu clinics. We also do flu vaccinations here in the office by appointment. COVID vaccines, you're probably aware that there is a new updated vaccine right now. If you've already had your initial COVID vaccine series, then you'd be eligible for the new updated vaccine 2 months after your last COVID vaccine. If you've had COVID recently, we anticipate that you have some immunity for the next 3 months, and your body will develop a more robust immune response if you wait for about 3 months after having COVID. Now, your own personal considerations will play into when you get vaccinated again. If you had COVID last month and you're just about to get on a cruise, you might choose to get your COVID vaccine now. You can call us at the Health District or talk to your primary care provider to weigh those sorts of choices. We are offering the Moderna COVID-19 vaccine for people ages 5 and up. There are other COVID vaccines, including Pfizer. You can access those or get more appointment opportunities than what we offer here by going to vaccines.gov. These are some screenshots of how you use that website. It's fabulous. You just click on Find COVID-19 Vaccines, put in your zip code, click the box for the kind of vaccine that you want, and then you get a map showing all the spots that have that vaccine. There's also a box that you can click from this screen that says Bridge Access Program. If you are uninsured or underinsured, those are places where you'd be able to get the vaccine for no cost. The state has a program to help children who are uninsured or underinsured get the vaccine for free also. So that's the end of this presentation. If you have any questions, please contact us at the Health District, and thank you so much for participating in this presentation.